Hi, this is Paul Conway, and welcome to the preface session of the Global Summit. During this session, you'll hear from a number of different experts who, in each of their capacities, have seen the growing interest and demand for an international consortium of patient consumers who are focused on helping others that are involved in innovation drive solutions to the patient community. One of our first speakers is Fokko Wieringa, and Fokko is the principal scientist at the IMEC in the Netherlands. He's an engineer by training, but most importantly to us, he's a very strong patient advocate and a friend. His engineering solutions and background have him very focused on the role that patients have in developing the solutions that they will benefit from. He believes in human factors engineering, or more simply put, putting the patient at the center of the solutions that folks are working on so that they make sense and that they're readily adopted once they become available. He has got a great sense of humor, very strong opinions. Here in the United States, he has been an influential voice in the Kidney Health Initiative, which is a formal partnership between the United States Food and Drug Administration and the world's largest nephrology society, the American Society of Nephrology, one of our allied organizations. Again, Fokko is a good friend and somebody who brings a very unique perspective to the pursuit for innovations and treatments on a timely basis for patients who suffer. He's one of the greatest friends we have in the kidney community. Fokko?
Well, thanks for that nice intro, and I hope I will not disappoint you. So here we go. Today, I'm here to talk about how we in Europe joined AAKP's Decade of the Kidney. And with we, I mean the European Kidney Health Alliance, the Dutch Kidney Foundation, and IMEC, where I also work. Now, let me first introduce the European Kidney Health Alliance, which is for all kidney health stakeholders that are not for profit in Europe. That consists of patients, nephrologists, healthcare workers, and researchers who all jointly advise the European Commission. It's more or less the equivalent of what you have in the US, the excellent, kidney caucus from the US Congress. You may recognize something there. You say, wait a minute, that looks like Kidney Health Initiative that you have in the US, and that's totally true. The European Kidney Health Alliance and Kidney Health Initiative are more or less twin sisters, or at least very close to it. And I like these cartoon series, by the way. These two sisters who all do kind of research says, since we work on the same problems, we'd better work together. And that is why we joined the Decade of the Kidney from AAKP, because that is the perfect vehicle in which patients worldwide unite on that is what interesting the most, namely how to get better treatments and how to get better prevention on kidney disease. It's a wonderful, wonderful initiative of AAKP. And now, the Dutch Kidney Foundation. I promised to introduce you to that as well. Well, the Dutch Kidney Foundation has a kind of a head start with kidney foundations because dialysis started in the Netherlands. In 1945, Dutch Dr. Kolff invented the first hemodialysis machine that actually was clinically usable. And he treated the first patient that survived acute kidney injury. And that was quite special because it was a miracle in those days if you would awake from a uremic coma. But if we look upon all kinds of artificial hearts and eyes and hips and hands and ears, what happened? The artificial kidney is still extremely big. And Kolff wanted it to make it small, wearable, maybe even implantable. Just as he did with the artificial heart. You can see him on this photograph holding the first artificial heart that was actually implanted into a patient, and that really worked. So that was another invention of this wonderful man who got the name Father of Artificial Organs. And there will be another speaker today telling more about that. So this wonderful invention of dialysis was made in 1945. And here we see a cartoon that we, as the European Kidney Health Alliance, gave out on World Kidney Day this year. So what happened? Well, 50 years of adding smartness into nearly everything, but somehow in the 70s, the roaring speed of innovation grinded more, well, to a halt, I wouldn't say, but it slowed down considerably. So whereas in 1971, people really would say, well, in 10 years, dialysis will be portable. Now look what happened to the guy. If we look upon beyond the curtains, if we look upon what stayed the same, it is being tied to the wall. The machines have been improved, that's true, but they're still big and they're still tied to the wall. They need a lot of water and they need a big drain and they need a lot of electrical power and a grounded powered outlet. Even though the guy got a smart toilet and he can order the toilet paper if it's delivered by a drone automatically, and his vacuum cleaner is a robot, his machine is more or less for him the same. So how can we do something about that? Well, so far, dialysis is, asking from the patients to schedule their lives around their therapies. But we want to do it different with the Dutch Kidney Foundation. So we want to schedule the treatment around the life of the patient. And for that, we think that patients should be able to do it at home, but also be able to travel. And the only thing that ties this machine to the wall is the plug, the power plug. But it will work from a 3-amp fuse, which is very low. It will work in the US, Japan, in Europe, no matter where. And it will not need a drain, and it will not need a water connection, and the plug does not even have to be grounded. You see that small suitcase standing there? Well, that's still fitting the carry-on luggage requirements, and it'll fit in there because you can fold it a little bit back, and that is just the first step. The first step, because what we have done is we recognize the great initiative of the Kidney Health Initiative to write a roadmap, a technology innovation roadmap, to describe how we could come from what we are now, where we are now, until, for instance, an implantable artificial kidney. Sounds like science fiction, but I tell you, the science is much more than the fiction. And we were so happy that we could join from Europe, to join and write on that technology roadmap, which was presented in Washington here with a great bunch of great people, and always patients present. And AAKP played a big role in that. Have to be acknowledged. So, okay, road mapping. Dr. Wieringa claims that's beneficial. What the heck is road mapping? Well, graphically summarizing this guy shows a 1970s big mainframe computer and says, someday you'll be able to hold one of these in the palm of your hand while you poop. And you know what? It actually has come true. Because nowadays, you can hold your phone in your hand and do whatever you want. I'm not arguing with that. But your cell phone holds way much more computing power than the entire Apollo program. But fortunately for you, it costs only a fraction. And that comes through the power of road mapping, where industry is agreeing upon milestones. And although direct competitors in the market realizing that to realize those technologies step by step, you need to work together to get it done. That has happened in semiconductor industry, and that's why all these electronic stuff that the guy in the previous cartoon had is actually come true for a low price. What does IMEC do? Because I promised to introduce you to 3 things. Well, IMEC is basically exploring the power of road mapping in semiconductor industry. We are a not-for-profit research hub for nanotechnology, and we push the limits of what can be done on chip. And just to graphically illustrate this, look upon this nurse in 1962, a miracle of the world, an ECG monitor. That was great. It worked. It was heavy, I can tell you. And, it was a bit not supportable. When I started working in hospital in 1986, this was the most modern monitor that we had, and it could measure ECG and respiration. Why it weighed less, it was more compact and much more reliable. But you now look upon, from that moment on, chips starting to become more and more integrated. In 2016, IMEC made a chip of 1 square centimeter, which could measure ECG, bioimpedance spectroscopy, and SpO2 plus respiration. You know what? Only 5 years later, the chip is 4 times as small, but does more than double of the functions. And that is the power of road mapping, making it smaller, making it cheaper, and making it more performance on a square millimeter. That's what Moore's law is about. And with this experience in pushing roadmaps, we think that if we transfer that experience also to the kidney roadmap, that'll certainly help to push things forward. So what we think might be the future is that we can help to make artificial kidneys really go back into the body where you would like to have them to carry them around, so that the blood connection is actually in your body, and that means the risk of infection is much lower, that your heart will be the blood pump that is pumping around. And although there are groups that already do that, which we really applaud, we can add some smartness into those devices. So what we think is that with the groups that are actually in the US, by the way, doing a great job on making the membranes and the parts of the engine that will function as an artificial kidney, we can add smartness with electronics on that to do wonderful extra things like wireless connection, wireless communication and charging, measuring diverse parameters in the body like core body temperature. Well, if you're in the body, core body temperature is easy to measure anyhow. Fluid status monitoring, real time, all the time, and also have ways to better remove protein-bound toxins, for instance. And that is not science fiction. It's science, and it can be done, and it can be even done with very, very small chips that could be compatible with the ongoing projects that are already targeting artificial kidneys. Will it be easy? No. But your President Kennedy once said, we're not doing this because it's easy. We're doing this because we think it must be done. And that is indeed what I see with all the patients. The decade of the kidney is this ambitious thing. Let's do this and combine science and technology from different sites, putting it all in a take-home message. Well, let's combine our individual puzzle pieces of technology and knowledge and join the decade of the kidney to puzzle around until we finally have a much better kidney replacement therapy that will be cheaper, that will be more efficient, and give patients much more freedom to move around. And if anybody wants to talk about that topic, you're totally welcome, and my contact details are in that slide. Thank you very much for your attention. It was a pleasure and an honor to be asked for this great AAKP Congress.
Thank you, Fokko, my friend, for your great presentation. Now I'd like to throw a question at you. Can you tell me how, as an engineer and as somebody who draws from many different disciplines as a professional, a patient-consumer consortium around the world can be supportive for your efforts? And just as importantly, how patient consumers in a consortium that's global can help political leaders, help folks like you who are engineering the solutions for kidney diseases?
Well, that's a very good question. In fact, two questions, and I think they're the core. They are really the core and the key to innovation. Well, a global patient consumer consortium will really have a voice that cannot be ignored by the decision makers upon research resources. And those, of course, are politicians that determine how we are going to address the future questions. And policymakers, since this is a global problem, I mean, kidney health is really a global problem. So it would be logical that policymakers from around the world would indeed also unite, like ECHA and KHI also say, since we're working on the same problems, we'd better work together. Same thing for the politicians that are working on this. And so I think it's a wonderful idea that patients would be engaged in that discussion. And they will give you useful information because they know how it is and they know what they would need in their daily life. So that's an excellent idea.
Thank you very much, Fokko, for your presentation and for answering my question.